Postmortem findings of the abortion depend upon the mode of abortion practiced, time elapsed between abortion and death. In sudden death, women may have found in a posture consistent with the recent abortion. Lower garment pushed up, legs spread wide apart, a syringe or other instrument within a genital canal, apparatus and paraphernalia stripped down, time elapsed between death and postmortem examination. In all cases of criminal abortion, female genitalia must be excised out of the body and examined. Maintain a full photographic record of all procedures conducted and findings. Abortion by drugs. Local examination of genitals, corrosion, erosion, inflammation of the vulva, vagina, cervix, etc. indicative. Local application of corrosives and irritant. Preserve vaginal and vulval washing. Match those with found at the crime scene. GAT, look for signs of congestion, inflammation, irritant poisoning. If present, indicative administration of GAT irritant. Examine entire GAT carefully. Preserve entire GAT content for chemical analysis. Urinary tract, look for signs of congestion, inflammation, irritant poisoning. If present, indicate administration of cantharidin turpentine. Instrumental abortion, air embolism. Infection seen in delayed death. Indicates instrumental abortion. Vagina walls may show pus. There may be frank discharge uterus. Uterine sepsis usually involves endometrium, especially the maternal site, and pieces of the retained product. Myometrium tube adjacent pelvic organs, peritoneum infected. Infection is rare in natural abortions. Natural abortion infection is rare. Injuries, site on vagina, cervix, uterus, sometimes on abdomen also. There may be abrasion, bruising, foreign bodies, hemorrhage, inflammation, laceration, perforation, punctuator aperture. Bleeding in peritoneal cavity indicates puncture through and through the genital tract. In the vagina, injuries are present in the walls and especially the posterior fornix. Extent damage is more in unskilled or semi-skilled hands and also during attempt at self-abortion. All organs constituting genital canal, vagina, cervix, uterus may show perforation of various size and shapes. The size of perforation may vary from a small ragged pinpoint to a large tear of oval, round, stellate or irregular shape. Perforation of uterus indicates penetration into the abdominal cavity, and abdominal injuries are must specifically searched for. Perforation, tears, etc. may be found on bladder, intestine, small and large, including rectum, mesentery, and omentum. If very large instruments, cycle spokes are used, even diaphragm may be pierced, causing injury to the lungs and heart. Nature of injuries reveal the type of instrument, example pointed, blunt, penetrating, etc. Dissection of uterus. Normally, uterus is opened by a vertical anterior incision. However, in instrumental abortion, it may be opened first by a classical cesarean section, which facilitate collection of any fluid retained in the lower uterine segment. Note following point, especially if chorionic sac is still present. Note its integrity and attachment to decidua. Look for product of conception. Note state of placental blood, dissection of cervical canal, open longitudinally and examine of injuries. Note state of dilatation, mucosal plug, the cervix would displace or disintegrated. Injury to the cervix in about 50% of all cases may show all kinds of injury, including cavitation of the wall, fissures, laceration, and perforation. There may be tenaculum mark on the external orifices. There may be tenaculum. There may be mucus plug. The dissection of cervical canal examined for displays injury to cervix. Kinds of injury including cavitation of fissures, lacer. There may be tenaculum marks on the external orifice. Canal may be groove-like parallel notches. Materials to be preserved: fetal blood and tissues. DNA profiling would establish a maternity if required paternity, especially if suspected father was once the who conducted criminal abortion. For fatty acid estimation and for phenolic derivative depending upon the agent used. Foreign bodies, if recovered from anywhere, especially within the genital canal or uterus, it must be preserved and sent for analysis. Sometimes ragged soaked in irritant solution may be recovered. Sometimes they are inserted there merely to stop abortion bleeding. Instrumentation of abortion for toxicology. Abortion stick for microbiology, for typing of blood, whether it matches that of mother, fetus, and or both. maternal blood for toxicology and microbiology, for typing and matching with that found at the scene and on the instruments. Scene of crime. All suspected material found at the scene of crime: bark, bottle, container, nozzles, syringes, tubes, twigs of plants, etc. Material expelled from the uterus, tissue from vagina, uterus, cervical canal, ovaries, and all major internal organs for histopathology. Washing from vagina, cervix, uterine cavity for toxicology and microbiology. Alternatively, entire genital system may be sent frozen for toxicology analysis. Abortion by syringing, same as in instrumental abortion. Additional findings: clots may be solved with the fluid. Genital canal may show corrosion or a tissue damage due to use of aseptic, irritant, and corrosives. Fluid: dark red fluid found between uterine wall and fetal membrane with a partial detachment of the placenta. If a soap has been used, fluid may be foamy. Venous system: uterine, ovarian, and pelvic veins and all veins extending from the side of the uterus up to the right heart, coronary vessels. Superior and inferior vena cava, pulmonary conus may show bubbles of gas and slimy fluid. Veins may be ballooned out, may show segmentation, may have a beaded appearances. On touching, they have a characteristic elastic feeling. Mechanism of entry: as fluid is pushed into the uterus under pressure, it enters the dilated uterine sinusoid along with the air. So, abortion by syringing, instrumental abortion, abortion by drugs. Postmortem. Thank you.